Come in. Hello, Dr. Megna.
Hello, doctor.
Are you ready to do your oral exam or your oral test in psychiatry today?
Yes, I'm prepared.
Great. So you know what we do is that I will present a case to you and then I'll begin to ask you some questions about the case. All right,
Okay.
so I'll begin describing a real case that actually presented in my clinic. A 19-year-old female would come to your office as a new patient to establish care. She's recently moved to the area to start school at a nearby university. As you notice her speaking, the skin on her hands is quite dry and cracked in places. She says, "I have to wash them a lot. I can't stand leaving them dirty." You notice that she's becoming increasingly restless as you speak to her. Suddenly, she stands up from the exam table and moves to the sink. When she washes her hands, she says, "I'm so sorry, I know this seems weird, but I really can't stand having germs on my hands." As you begin to question her further, she tells you that although she has always been a clean freak, she has recently started washing her hands countless times per day. I wish I could stop, but I just can't." She admits the recent move away from home has been stressful. In her new apartment, her organizational expertise is beginning to affect her relationship with her new roommate. She says, "I have to organize the spice rack alphabetically. My roommate never puts them back in the right place, but I feel like I always have to check and make sure they're in the right order before I leave the house. At the end of your visit, she says to you, 'Please help me. I'm tired of this.'" Is there anything in that presentation that you wanted to ask me about before I ask you some questions?
Nope, not at all.
Great, okay then. So what is the most likely diagnosis in this patient?
In this case, this person has obsessive compulsive disorder, better known as OCD.
Right. So what would make you think that she has OCD?
A few reasons. She's age 19, which is when some people begin to show symptoms and signs they have OCD.
Most people, in fact, right?
Yes.
That's the most common age.
As well, she shows a couple things, couple obsessions and compulsions. First off, the hand washing. That is a very common obsession with those who have OCD. She said she's a germ freak, and that's her obsession. The second is the spice rack. Because of the obsession with the spice rack being in alphabetical order, she's compelled to rearrange it when her roommate messes it up. And the fact that she knows it's kind of irregular for her to be obsessed like this proves that's another sign proving or suggesting she has obsessive compulsive disorder.
You're right, because somebody with an obsessive compulsive personality disorder doesn't admit to having any problems, so you're perfectly right there. So why would she, what's in it for her if she's constantly checking the spice rack or washing her hands and compelled to do this? Why does she do this?
These compulsions are used to relieve her anxiety. It's as simple as that.
So now this young woman says to you, "Did I get this from my parents, or can I inherit this? What's going on?" What would you say?
Well, for those who have a parent with OCD, they have up to a 10% chance of getting OCD themselves.
And if she said, "Well, do many people have OCD? I mean, am I the only one that feels
Well,
like?"
roughly 2.5% of the entire world's population has had OCD at some point in their life.
Right. And so then this young woman says to you, "Dr. Megna, is there anything you can do for me?" What would your answer be?
Yeah, there's two solutions to this. One is treating medically, one is through therapy.
Right. And the medical treatment, what would you do in that case?
Medically, there's drugs called SSRI, which stands for Selective Serotonin Reuptake Inhibitor.
And what would that do? Why would you choose that kind of drug?
Well, what happens with OCD is inside the brain there's a lack of serotonin. And the serotonin is the messenger that carries signals from the frontal lobe to deeper portions of the brain. And with this drug, it increases the amount of serotonin available for use in the brain.
Excellent. Yes. And what about the therapy? What would you choose in that case?
The main type of therapy used to help OCD is called CBT, or Cognitive Behavioral Therapy. And what it is it gives patients skills they can use to reframe the way they think about their obsessions.
Yes, well, you do seem to have a good grasp of OCD, Dr. Megna. I'm wondering if you have come across any other examples as an intern in the last while of a patient with OCD.
So just a couple of months ago, a 21-year-old patient of mine displayed symptoms of OCD. He's a pizza delivery man, and as he was driving, he started thinking to himself that he'd hit someone and badly hurt them. As he kept driving, he became more and more anxious and guilty about it. This obsession led him eventually to return to his crime scene and see that no one was there and nothing had happened at all. That was his response to his obsession, the returning to the crime scene.
And that returning to the crime scene over and over again, what does that do for him?
What it did was that compulsion relieved his anxiety.
Just in the short term, right. Yeah, well, that's a very good example. I think it's excellent that you understand this, because it's important that doctors do. It takes a patient with OCD sometimes more than 10 years to receive the right diagnosis. They aren't asked the right questions, and they're very embarrassed because, like the patient that presented in the case today, they feel weird and they feel that they'll be discriminated against. So it's very important to let these people know that there's help out there. So excellent, and you'll make a very good psychiatrist, Dr. Megna.
Thank you, Doctor.